NCLEX latest exam questions, 2026. Question 1. A nurse is providing care based on Maslow's hierarchy of basic human needs. For which nursing activities is this approach useful? A. Making accurate nursing diagnoses. B. Establishing priorities of care. C. Communicating concerns more concisely. D. Integrating science into nursing care. The correct answer is establishing priorities of care. Maslow's hierarchy of basic human needs is useful for establishing priorities of care. Question 2. The nurse is prioritizing nursing care for a patient in a long-term care facility. Which examples of nursing interventions help meet physiologic needs? Select all that apply. A. Preventing falls in the facility. B. Changing a patient's oxygen tank. C. Providing materials for a patient who likes to draw. D. Helping a patient eat his dinner. B. Facilitating a visit from a spouse. F. Referring a patient to a cancer support group. The correct answer is changing a patient's oxygen tank and helping a patient eat his dinner. B. Facilitating a visit from a spouse. F. Referring a patient to a cancer support group. Physiologic needs: oxygen, water, food, elimination, temperature, sexuality, physical activity, and rest must be met at least minimally to maintain life. Providing food and oxygen are examples of interventions to meet these needs. Preventing falls helps meet safety and security needs. Providing art supplies may help meet self-actualization needs. Facilitating visits from loved ones helps meet self-esteem needs. And referring a patient to a support group helps meet love and belonging needs. Question 3. The nurse caring for patients postoperatively uses careful hand hygiene and sterile techniques when handling patients. Which of Maslow's basic human needs is being met by this nurse? A. Physiologic. B. Safety and security. C. Self-esteem. D. Love and belonging. The correct answer is safety and security. By carrying out careful hand hygiene and using sterile technique, nurses provide safety from infection. An example of a physiologic need is clearing a patient's airway. Self-esteem needs may be met by allowing an older adult to talk about a past career. An example of helping meet a love and belonging need is contacting a hospitalized patient's family to arrange a visit. Question 4. The nurse caring for patients in a long-term care facility knows that the highest level on Maslow's hierarchy of needs is self-actualization needs. Which statements accurately describe the achievement of self-actualization? Select all that apply. A. Humans are born with a fully developed sense of self-actualization. B. Self-actualization needs are met by depending on others for help. C. The self-actualization process continues throughout life. D. Loneliness and isolation occur when self-actualization needs are unmet. E. A person achieves self-actualization by focusing on problems outside self. F. Self-actualization needs may be met by creatively solving problems. The correct answer is the self-actualization process continues throughout life. Self-actualization, or reaching one's full potential, is a process that continues throughout life. A person achieves self-actualization by focusing on problems outside oneself and using creativity as a guideline for solving problems and pursuing interests. Humans are not born with a fully developed sense of self-actualization, and self-actualization needs are not met specifically by depending on others for help. Loneliness and isolation are not always the result of unmet self-actualization needs. Question 5. A nurse works with families in crisis at a community mental health care facility. What is the best broad definition of a family? A. A father, a mother, and children. B. A group whose members are biologically related. C. A unit that includes aunts, uncles, and cousins. D. A group of people who live together and depend on each other for support. The correct answer is a group of people who live together and depend on each other for support. Although all the responses may be true, the best definition is a group of people who live together and depend on each other for physical, emotional, or financial support. Question 6. A nurse performs an assessment of a family consisting of a single mother, a grandmother, and 2 children. Which interview questions directed to the single mother could the nurse use to assess the effective and coping family function? Select all that apply. A. Who is the person you depend on for emotional support? B. Who is the breadwinner in your family? C. Do you plan on having any more children? D. Who keeps your family together in times of stress? E. What family traditions do you pass on to your children? F. Do you live in an environment that you consider safe? The correct answer is who is the person you depend on for emotional support? And who keeps your family together in times of stress? E. What family traditions do you pass on to your children? F. Do you live in an environment that you consider safe? The 5 major areas of family function are physical, economic, reproductive, affective and coping, and socialization. Asking who provides emotional support in times of stress assesses the affective and coping function. Assessing the breadwinner focuses on the economic function. Inquiring about having more children assesses the reproductive function. Asking about family traditions assesses the socialization function, and checking the environment assesses the physical function. Question 7. The nurse caring for families in a free healthcare clinic identifies psychosocial risk factors for altered family health. Which example describes one of these risk factors? A. The family does not have dental care insurance or resources to pay for it. B. Both parents work and leave a 12-year-old child to care for his younger brother. C. Both parents and their children are considerably overweight. D. The youngest member of the family has cerebral palsy and needs assistance from community services. The correct answer is both parents work and leave a 12-year-old child to care for his younger brother. Inadequate childcare resources is a psychosocial risk factor. Not having access to dental care and obese family members are lifestyle risk factors. Having a family member with birth defects is a biologic risk factor. Question 8. Shuba and Raul are a couple in their late 70s. According to Duval, which developmental task is appropriate for this older adult family? A. Maintain a supportive home base. B. Strengthen marital relationships. C. Cope with loss of energy and privacy. D. Adjust to retirement. The correct answer is adjust to retirement. The developmental tasks of the family with older adults are to adjust to retirement and possibly to adjust to the loss of a spouse and loss of independent living. Maintaining a supportive home base and strengthening marital relationships are tasks of the family with adolescents and young adults. Coping with loss of energy and privacy is a task of the family with children. Question 9. A visiting nurse performs a community assessment in an area of the city in which the nurse will be working. What is one element of a healthy community? A. Meets all the needs of its inhabitants. B. Has mixed residential and industrial areas. C. Offers access to health care services. D. Has modern housing and condominiums. The correct answer is offers access to health care services. A healthy community offers access to health care services to treat illness and to promote health. A healthy community does not usually meet all the needs of its residents, but should be able to help with health issues such as nutrition, education, recreation, safety, and zoning regulations to separate residential sections from industrial ones. The age of housing is irrelevant as long as residences are maintained properly according to code. Question 10. A nurse is practicing community-based nursing in a mobile health clinic. What would be the central focus of this nurse's care? A. Individual and family healthcare needs. B. Populations within the community. C. Local healthcare facilities. D. Families in crisis. The correct answer is individual and family healthcare needs. In contrast to community health nursing, which focuses on populations within a community, community-based nursing is centered on individual and family healthcare needs. Community-based nurses may help families in crisis and work in healthcare facilities, but these are not the focus of community-based nursing. Question 11. A nurse is caring for a patient in the ICU who is being monitored for a possible cerebral aneurysm following a loss of consciousness in the emergency room. The nurse anticipates preparing the patient for ordered diagnostic tests. This nurse's knowledge of the diagnostic procedures for this condition reflects which aspect of nursing? A. The art of nursing. B. The science of nursing. C. The caring aspect of nursing. D. The holistic approach to nursing. The correct answer is the science of nursing. The science of nursing is the knowledge base for care that is provided. In contrast, the skilled application of that knowledge is the art of nursing. Providing holistic care to patients based on the science of nursing is considered the art of nursing. Question 12. Which nurse who was influential in the development of nursing in North America is regarded as the founder of American nursing? A. Clara Barton. B. Lillian Wald. C. Lavinia. D. Florence Nightingale. The correct answer is Florence Nightingale. Florence Nightingale elevated the status of nursing to a respected occupation, improved the quality of nursing care, and founded modern nursing education. Clara Barton established the Red Cross in the United States in 1882. Lillian Wald is the founder of public health nursing. Lavinia was a nursing leader and women's rights activist instrumental in women's right to vote. Question 13. In early civilizations, the theory of animism attempted to explain the mysterious changes occurring in bodily functions. Which statement describes a component of the development of nursing that occurred in this era? A. Women who committed crimes were recruited into nursing the sick in lieu of serving jail sentences. B. Nurses identified the personal needs of the patient and their role in meeting those needs. C. Women called deaconesses made the first visits to the sick and male religious orders cared for the sick and buried the dead. D. The nurse was the mother who cared for her family during sickness by using herbal remedies. The correct answer is the nurse was the mother who cared for her family during sickness by using herbal remedies. The theory of animism was based on the belief that everything in nature was alive with invisible forces and endowed with power. In this era, the nurse usually was the mother who cared for her family during sickness by providing physical care and herbal remedies. At the beginning of the 16th century, the shortage of nurses led to the recruitment of women who had committed crimes to provide nursing care instead of going to jail. In the early Christian period, women called deaconesses made the first organized visits to sick people, and members of male religious orders gave nursing care and buried the dead. The influences of Florence Nightingale were apparent from the middle of the 19th century to the 20th century. One of her accomplishments was identifying the personal needs of the patient and the nurse's role in meeting those needs. Question 14. World War II had a tremendous effect on the nursing profession. Which development occurred during this period? A. The role of the nurse was broadened. B. There was a decreased emphasis on education. C. Nursing was practiced mainly in hospital settings. D. There was an overabundance of nurses. The correct answer is the role of the nurse was broadened. During World War II, large numbers of women worked outside the home. They became more independent and assertive, which led to an increased emphasis on education. The war itself created a need for more nurses and resulted in a knowledge explosion in medicine and technology. This trend broadened the role of nurses to include practicing in a wide variety of healthcare settings. Question 15. Which phrase describes a purpose of the ANA's nursing social policy statement? Select all that apply. A. To describe the nurse as a dependent caregiver. B. To provide standards for nursing educational programs. C. To define the scope of nursing practice. D. To establish a knowledge base for nursing practice. E. To describe nursing's social responsibility. F. To regulate nursing research. The correct answer is to define the scope of nursing practice and to establish a knowledge base for nursing practice. E. To describe nursing's social responsibility. F. To regulate nursing research. The ANA Social Policy Statement, 2010, describes the social context of nursing, a definition of nursing, the knowledge base for nursing practice, the scope of nursing practice, standards of professional nursing practice, and the regulation of professional nursing. Question 16. One of the four broad aims of nursing practice is to restore health. Which examples of nursing interventions reflect this goal? Select all that apply. A. A nurse counsels adolescents in a drug rehabilitation program. B. The nurse performs range of motion exercises for a patient on bed rest. C. The nurse shows a diabetic patient how to inject insulin. D. The nurse recommends a yoga class for a busy executive. E. A nurse provides hospice care for a patient with end-stage cancer. F. A nurse teaches a nutrition class at a local high school. The correct answer is a nurse counsels adolescents in a drug rehabilitation program. And a nurse performs range of motion exercises for a patient on bed rest. And a nurse shows a diabetic patient how to inject insulin. Activities to restore health focus on the individual with an illness and range from early detection of a disease to rehabilitation and teaching during recovery. These activities include drug counseling, teaching patients how to administer their medications, and performing range of motion exercises for bedridden patients. Recommending a yoga class for stress reduction is a goal of preventing illness, and teaching a nutrition class is a goal of promoting health. A hospice care nurse helps to facilitate coping with disability and death. Question 17. Nursing is recognized increasingly as a profession based on which defining criteria? Select all that apply. A. Well-defined body of general knowledge. B. Interventions dependent upon the medical practice. C. Recognized authority by a professional group. D. Regulation by the medical industry. E. Code of ethics. F. Ongoing research. The correct answer is recognized authority by a professional group. Nursing is recognized increasingly as a profession based on the following defining criteria: well-defined body of specific and unique knowledge, strong service orientation, recognized authority by a professional group, code of ethics, professional organization that sets standards, ongoing research, and autonomy and self-regulation. Question 18. A nurse is practicing as a nurse midwife in a busy OB/GYN office. Which degree in nursing is necessary to practice at this level? A. LPN. B. ADNC, BSN. D. MSN. The correct answer is MSN. A master's degree, MSN, prepares advanced practice nurses. Many master's graduates gain national certification in their specialty area, for example, as family nurse practitioners, FNPs, or nurse midwives. Question 19. Nurse practice acts are established in each state of the United States to regulate nursing practice. What is a common element of every state practice act? A. Defining the legal scope of nursing practice. B. Providing continuing education programs. C. Determining the content covered in the NCLEX examination. D. Creating institutional policies for healthcare practices. The correct answer is defining the legal scope of nursing practice. Nurse Practice Acts are established in each state to regulate the practice of nursing by defining the legal scope of nursing practice, creating a state board of nursing to make and enforce rules and regulations, define important terms and activities in nursing, and establish criteria for the education and licensure of nurses. The acts do not determine the content covered on the NCLEX, but they do have the legal authority to allow graduates of approved schools of nursing to take the licensing examination. The acts also may determine educational requirements for licensure, but do not provide the education. Institutional policies are created by the institutions themselves. Question 20. The National Advisory Council on Nurse Education and Practice identifies critical challenges to nursing practice in the 21st century. What is a current healthcare trend contributing to these challenges? A. Decreased numbers of hospitalized patients. B. Older and more acutely ill patients. C. Decreasing healthcare costs due to managed care. D. Slowed advances in medical knowledge and technology. The correct answer is older and more acutely ill patients. The National Advisory Council on Nurse Education and Practice identifies the following critical challenges to nursing practice in the 21st century: a growing population of hospitalized patients who are older and more acutely ill, increasing healthcare costs, and the need to stay current with rapid advances in medical knowledge and technology. Question 21. A nurse assesses patients in a physician's office who are experiencing different levels of health and illness. Which statements best define the concepts of health and illness? Select all that apply. A. Health and illness are the same for all people. B. Health and illness are individually defined by each person. C. People with acute illnesses are actually healthy. D. People with chronic illnesses have poor health beliefs. E. Health is more than the absence of illness. F. Illness is the response of a person to a disease. The correct answer is health and illness are individually defined by each person. Each person defines health and illness individually, based on a number of factors. Health is more than just the absence of illness, it is an active process in which a person moves toward one's maximum potential. And illness is the response of the person to a disease. Question 22. The student nurse learns that illnesses are classified as either acute or chronic. Which are examples of chronic illnesses? Select all that apply. A. Diabetes mellitus. B. Bronchial pneumonia. C. Rheumatoid arthritis. D. Cystic fibrosis. E. Fractured hip. F. Otitis media. The correct answer is diabetes mellitus and rheumatoid arthritis and cystic fibrosis. E. Fractured hip. F. Otitis media. Diabetes, arthritis, and cystic fibrosis are chronic diseases because they are permanent changes caused by irreversible alterations in normal anatomy and physiology, and they require patient education along with a long period of care or support. Pneumonia, fractures, and otitis media are acute illnesses because they have a rapid onset of symptoms that last a relatively short time. Question 23. Despite a national focus on health promotion, nurses working with patients in inner-city clinics continue to see disparities in healthcare for vulnerable populations. Which patients would be considered vulnerable populations? Select all that apply. A. A white male diagnosed with HIV/B. An African American teenager who is 6 months pregnant. C. A Hispanic male who has type 2 diabetes. D. A low-income family living in rural America. E. A middle-class teacher living in a large city. F. A white baby who was born with cerebral palsy. The correct answer is an African American teenager who is 6 months pregnant and a Hispanic male who has type 2 diabetes in a low-income family living in rural America. E. A middle-class teacher living in a large city. F. A white baby who was born with cerebral palsy. National trends in the prevention of health disparities are focused on vulnerable populations, such as racial and ethnic minorities, those living in poverty, women, children, older adults, rural and inner-city residents, and people with disabilities and special health care needs. Question 24. A nurse has volunteered to give influenza immunizations at a local clinic. What level of care is the nurse demonstrating? A. Tertiary. B. Secondary. C. Primary. D. Promotive. The correct answer is primary. Giving influenza injections is an example of primary health promotion and illness prevention. Question 25. A nurse's neighbor tells the nurse, "I have a high temperature, feel awful, and I am not going to work." What stage of illness behavior is the neighbor exhibiting? A. Experiencing symptoms. B. Assuming the sick role. C. Assuming a dependent role. D. Achieving recovery and rehabilitation. The correct answer is assuming the sick role. When people assume the sick role, they define themselves as ill, seek validation of this experience from others, and give up normal activities. In stage 1, experiencing symptoms, the first indication of an illness usually is recognizing one or more symptoms that are incompatible with one's personal definition of health. The stage of assuming a dependent role is characterized by the patient's decision to accept the diagnosis and follow the prescribed treatment plan. In the achieving recovery and rehabilitation role, the person gives up the dependent role and resumes normal activities and responsibility. Question 26. Which clinic patient is most likely to have annual breast examinations and mammograms based on the physical human dimension? A. Jane, whose her best friend had a benign breast lump removed. B. Sarah, who lives in a low-income neighborhood. C. Tricia, who has a family history of breast cancer. D. Nancy, whose family encourages regular physical examinations. The correct answer is Tricia, who has a family history of breast cancer. The physical dimension includes genetic inheritance, age, developmental level, race, and gender. These components strongly influence the person's health status and health practices. A family history of breast cancer is a major risk factor. Question 27. Health promotion activities may occur on a primary, secondary, or tertiary level. Which activities are considered tertiary health promotion? Select all that apply. A. A nurse runs an immunization clinic in the inner city. B. The nurse teaches a patient with an amputation how to care for the residual limb. C. The nurse provides range of motion exercises for a paralyzed patient. D. The nurse teaches parents of toddlers how to childproof their homes. E. A school nurse provides screening for scoliosis for the students. F. A nurse teaches new parents how to choose and use an infant car seat. The correct answer is a nurse teaches a patient with an amputation how to care for the residual limb, and a nurse provides range of motion exercises for a paralyzed patient. Tertiary health promotion and disease prevention begins after an illness is diagnosed and treated to reduce disability and to help rehabilitate patients to a maximum level of functioning. These activities include providing ROM exercises and patient teaching for residual limb care, providing immunizations and teaching parents how to childproof their homes and use an appropriate car seat are primary health promotion activities. Providing screenings is a secondary health promotion activity. Question 28. The agent-host environment model of health and illness is based on what concept? A. Risk factors. B. Demographic variables. C. Behaviors to promote health. D. Stages of illness. The correct answer is risk factors. The interaction of the agent, host, and environment creates risk factors that increase the probability of disease. Question 29. When providing health promotion classes, a nurse uses concepts from models of health. What do both the health-illness continuum and the high-level wellness models demonstrate? A. Illness as a fixed point in time. B. The importance of family. C. Wellness as a passive state. D. Health as a constantly changing state. The correct answer is health as a constantly changing state. Both these models view health as a dynamic, constantly changing state. Question 30. A nurse follows accepted guidelines for a healthy lifestyle. How can this promote health in others? A. By being a role model for healthy behaviors. B. By not requiring sick days from work. C. By never exposing others to any type of illness. D. By spending less money on food. The correct answer is by being a role model for healthy behaviors. Good personal health enables the nurse to serve as a role model for patients and families. Question 31. Nursing students are reviewing information about healthcare delivery systems in preparation for a quiz the next day. Which statements describe current U.S. healthcare delivery practices? Select all that apply. A. Access to care depends only on the ability to pay, not the availability of services. B. The Patient Protection and Affordable Care Act provides private health care insurance to the underserved populations. C. Every health insurance plan in the marketplace offers comprehensive coverage, from doctors to medications to hospital visits. D. The uninsured pay for more than one-third of their care out of pocket and are usually charged lower amounts for their care than the insured pay. E. 50 years ago, half of the doctors in America practiced primary care, but today fewer than 1 in 3 do. F. Equality of care can be defined as the right care for the right person at the right time. The correct answer is every health insurance plan in the marketplace offers comprehensive coverage, from doctors to medications to hospital visits. The marketplace is designed to help people more easily find health insurance that fits their budget. Every health insurance plan in the marketplace offers comprehensive coverage, from doctors to medications to hospital visits. 50 years ago, half of the doctors in America practiced primary care, but today fewer than 1 in 3 do. Quality is the right care for the right person at the right time. Access to care depends on both the ability to pay and the availability of services. The Patient Protection and Affordable Care Act provides Medicaid or subsidized coverage to qualifying people with incomes up to 400% of poverty. The uninsured pay for more than 1/3 of their care out of pocket and are often charged higher amounts for their care than the insured pay. Question 32. A nurse is providing secondary health care to patients in a healthcare facility. Which patients are receiving this level of care? Select all that apply. A patient enters a community clinic with signs of strep throat. B. The patient is admitted to the hospital following a myocardial infarction. C. The mother brings her son to the emergency department following a seizure. D. The patient with osteogenesis imperfecta is being treated in a medical center. E. A mother brings her son to a specialist to correct a congenital heart defect. F. A woman has a hernia repair in an ambulatory care center. The correct answer is a patient is admitted to the hospital following a myocardial infarction, and a mother brings her son to the emergency department following a seizure. Secondary health care treats problems that require specialized clinical expertise, such as in knee, a seizure, and a hernia repair. Treating strep throat is primary health care. Tertiary health care involves management of rare and complex disorders, such as osteogenesis imperfecta and congenital heart malformations. Question 33. A nurse working in a physician's office prepares insurance forms in which the provider is given a fixed amount per enrollee of the health plan. What is the term for this type of reimbursement? A. Capitation. B. Prospective payment system. C. Bundled payment. D. Rate setting. The correct answer is capitation. Capitation plans give providers a fixed amount per enrollee in the health plan in an effort to build a payment plan that consists of the best standards of care at the lowest cost. The prospective payment system groups inpatient hospital services for Medicare patients into DRGs. With bundled payments, providers receive a fixed sum of money to provide a range of services. Rate setting means that the government could set targets or caps for spending on healthcare services. Question 34. A nurse researcher keeps current on the trends to watch in healthcare delivery. What trends are likely included? Select all that apply. A. Globalization of economy and society. B. A slowdown in technology development. C. Decreasing diversity. D. Increasing complexity of patient care. E. Changing demographics. F. Shortages of key healthcare professionals and educators. The correct answer is globalization of economy and society and increasing complexity of patient care. E. Changing demographics. F. Shortages of key healthcare professionals and educators. Trends to watch in healthcare delivery include globalization of the economy and society, increasing complexity of patient care, changing demographics, shortages of key healthcare professionals and educators, technology explosion, and increasing diversity. Question 35. A nurse is caring for patients in a primary care center. What is the most likely role of this nurse based on the setting? A. Assisting with major surgery. B. Performing a health assessment. C. Maintaining patient's function and independence. D. Keeping student immunization records up to date. The correct answer is performing a health assessment. Performing patient assessments is a common role of the nurse in a primary care center. Assisting with major surgery is a role of the nurse in the hospital setting. Maintaining patient's function and independence is a role of the nurse in an extended care facility, and keeping student immunization records up to date is a role of the school nurse. Question 36. A caregiver asks a nurse to explain respite care. How would the nurse respond? A. The service that allows time away for caregivers. B. The special service for the terminally ill and their family. C. A direct care provided to individuals in a long-term care facility. D. Living units for people without regular shelter. The correct answer is a service that allows time away for caregivers. Respite care is provided to enable a primary caregiver time away from the day-to-day responsibilities of homebound patients. Question 37. A nurse caring for patients in a primary care setting submits paperwork for reimbursement from managed care plans for services performed. Which purpose best describes managed care as a framework for healthcare? A. The design to control the cost of care while maintaining the quality of care. B. Care coordination to maximize positive outcomes to contain costs. C. The delivery of services from initial contact through ongoing care. D. Based on a philosophy of ensuring death in comfort and dignity. The correct answer is a design to control the cost of care while maintaining the quality of care. Managed care is a way of providing care designed to control costs while maintaining the quality of care. Question 38. A nurse cares for dying patients by providing physical, psychological, social, and spiritual care for the patients, their families, and other loved ones. This service is known as A. Respite care, B. Palliative care, C. Hospice care, D. Extended care. The correct answer is hospice care. The hospice nurse combines the skills of the home care nurse with the ability to provide daily emotional support to dying patients and their families. Respite care is a type of care provided for caregivers of homebound ill, disabled, or older patients. Palliative care, which can be used in conjunction with medical treatment and in all types of healthcare settings, is focused on the relief of physical, mental, and spiritual distress. Extended care facilities include transitional subacute care, assisted living facilities, intermediate and long-term care, homes for medically fragile children, retirement centers, and residential institutions for mentally and developmentally or physically disabled patients of all ages. Question 39. A nurse is evaluating a patient diagnosed with renal disease for treatment in a hospital-at-home program. Which statement accurately describes a step in this program? A. The patient is evaluated upon hospital admission and is given daily nursing care in the home after discharge for as long as necessary. B. Any urgent or emergent situation requires an ambulance trip from the home to the hospital. C. Patients are transported to physicians' offices from the home for weekly evaluations. D. The clinicians use care pathways, clinical outcome evaluations, and specific discharge criteria. The correct answer is the clinicians use care pathways, clinical outcome evaluations, and specific discharge criteria. In the hospital-at-home program, the clinicians use care pathways including illness-specific care maps, clinical outcome evaluations, and specific discharge criteria. A patient requiring admission for one of the target illnesses is identified in the emergency department or ambulatory site. Staff assess whether the patient is a good candidate for the program using validated criteria. If the patient is eligible and consents to participate, the hospital-at-home physician evaluates the patient, who is then transported home, usually by ambulance. Nurses are available 24 hours a day / 7 days a week for any urgent or emergent situations. The patient is evaluated daily in the home by the hospital-at-home physician, who completes an assessment and continues to implement appropriate diagnostic and therapeutic measures.